Hey, what's up? What's your name?
Hey, my name is Guy. Why are you here?
My name's Maya, and when I was in college, it was really common for girls my age, around like 17, to contract gonorrhea, which is called the clap. And I never got it, and I never even thought about it after college because I'm a virgin, and I met my husband, and I got married, and like we have life together, but we've only really had oral sex. And even though I've never actually had sex, I recently started having like painful and frequent urination, and it comes with like foul-smelling vaginal discharge and some low abdominal pain. So I went to the doctor and to check it out, and it turns out I have gonorrhea. Even at my age, 24 and a virgin, right? I couldn't believe it. But when I talked to my doctor, he said that gonorrhea can be contracted through oral sex and not just vaginal or anal sex, and I want to get treated, so that's why I'm here. What about you?
My name is Guy, and I'm 16, and these are my premier 2 3 in school. I have no worries, no bills to pay, and I finally got eyelid. I was really happy, but then a few weeks later, I started peeing 10 times a day, and where I peed, it was quite thick and uncomfortable. I didn't think anything of it because I play sports, so I start drinking a lot of water. But even when I start my off season, the pain and itch wouldn't stop. So I told my dad, and he immediately told me to go to the doctor, and the doctor told me that I have contracted. My mind is blown. My life is over. I can't believe it. I have sexual transmitted infection for the rest of my life.
It's okay, Guy. That's why we're here.
Not to worry, girl and guy. My name is Dr. Gonorrhea, and I work with the Center for Disease Control, and we have a new facility where we use dual therapy to treat gonorrhea. We inject 240 milligrams of gentamicin combined with 2 grams of oral azithromycin, which has showed 100% effectiveness. Even though antibiotics for gonorrhea will fully stop the infection, they will unfortunately not repair any permanent damage caused by the disease, like arthritis. Gonorrhea is a serious disease. It is highly contagious and transmitted sexually. The disease doesn't only affect male and female genitalia, it also affects the rectum, throat, eyes, blood, skin, and joints. Gonorrhea can be contracted through other forms of sexual contact besides vaginal and anal sex, like oral sex and sharing sex toys, and touching yourself in vulnerable areas after touching an infected part of someone else. Inconsistent condom use among people not in mutually monogamous relationships is the biggest risk for contracting gonorrhea, but even a pregnant mother can even transmit the disease to her kid through childbirth. If you come into our facility, we will give you a gonorrhea test, where we ask for a urine test and swab the opening of the urethra. Then we will give you a genital examination. Usually our patients are women between the ages of 15 and 24, but we still have young men and also women of other ages that come into our facility. Nice to meet you. I'm Dr. Gonorrhea, and I'm confident that my treatment is going to help you all get cleared and good to go.
Thank you, doctor. I was so worried that I would have this disease for the rest of my life. It's so good to hear that you can help me out.
Yeah, honestly, thank you so much. My husband is going to be so happy that we were able to get this past us.
Of course you two. I'm happy to be able to help. STIs are a lot more common than people think, and seeking help is the only way to get the problem cleared up. Remember, if you have any friends or family who are experiencing similar problems, make sure they aren't too afraid to ask to get help. A lot of STIs go untreated and due to people's fear of acknowledgement, and so I'm proud of you two coming in to get help. Remember kids, if you're worried about STIs, go get yourself checked out.